If you spend any time on social media lately, you've probably heard someone talking about peptides. One person claims they help build muscle, another says they accelerated healing, someone else says they improve fat loss, sleep, recovery, or longevity. Now, depending on who you listen to, peptides can almost sound like a miracle. But here's the problem. Very few people stop to explain what peptides actually are, how they work, why they can affect more than one system in the body, and why taking them is not nearly as simple as ordering a vial online. Today I want to change that. By the end of this video, you'll understand not only what peptides are, but why they are some of the most fascinating and most misunderstood tools in modern medicine. You'll also understand why the source of the peptides matters just as much as the peptide itself. Hey everyone, welcome back to Pep Talks with Stu. I'm Stuart Riggins, nurse practitioner with Pinnacle Performance and Wellness. Now, over the past several years, I've watched peptides become one of the fastest growing topics in health, fitness, performance, and longevity. Unfortunately, I've also watched misinformation grow just as quickly. Every day I see videos promising incredible results, online forums recommending peptide protocols to complete strangers, and websites selling products while offering medical advice without ever evaluating the person who's going to use them. That is concerning because peptides are not vitamins. They are not protein powders. They are not magic. They are biologically active molecules capable of influencing the way your cells communicate. That does not mean they are something to fear. In fact, many peptides have tremendous therapeutic potential, and I believe they represent an exciting area of medicine. But like any powerful medical therapy, they deserve to be understood before they are used. My goal with this channel is not to sell you on peptides or scare you away from them. My goal is to help you understand the science behind them so you can make informed decisions based on physiology and evidence, not hype, marketing, or social media trends. So let's start at the beginning. What exactly is a peptide? At their simplest, peptides are short chains of amino acids, the same building blocks that make up proteins. But peptides are not just pieces of protein. Many function as biological signaling molecules. Think of them as messages. Your body is constantly sending chemical messages between cells. These messages tell cells when to grow, repair, rest, produce hormones, make energy, fight infection, or reduce inflammation. Without these signals, your body could not coordinate the millions of processes happening every second. Some naturally occurring peptides function as hormones, such as insulin. Others act locally within tissues. Many therapeutic peptides are designed to mimic, amplify, or influence these natural signaling molecules. So peptides are not simply supplements. They are part of the communication system that helps regulate human physiology. What are these signaling pathways? So to understand why peptides are so powerful, we first need to understand cellular signaling pathways. Imagine your body as a city. Every cell has a job. Some cells produce energy, some repair damaged tissue, some build muscle, some regulate inflammation, some fight infection, some manufacture hormones. For all those jobs to happen correctly, every cell has to communicate with other cells. Those communication networks are called cellular signaling pathways. These pathways help determine whether your body is building or breaking down tissue, storing or burning energy, increasing or decreasing inflammation, repairing damage, responding to stress, or producing new mitochondria. In other words, they help determine how your body functions every day. Now, the body is not a collection of separate systems. And one of the biggest misconceptions I see online is the idea that you can change one biological process without affecting anything else. That's almost never true. Your body functions more like an orchestra than a collection of individual instruments. Or imagine the gears inside a transmission. Every gear is connected to the others. If you change one gear, the entire system adjusts. Cellular signaling pathways work the same way. A peptide may be designed to influence one pathway, but because these pathways constantly interact, there can be downstream effects throughout the body. Sometimes those effects are beneficial, sometimes they're unexpected, and sometimes we're still learning what those downstream effects are. That is why biology rarely is as simple as social media makes it seem. This does not mean peptides are dangerous. It means they deserve respect. Many peptides have significant therapeutic potential. We're continuing to research how they influence tissue healing, metabolic health, mitochondrial function, inflammation, hormone regulation, and regenerative medicine. Some peptides already have established medical uses, while others remain investigational or are at least supported by early clinical evidence. The strength of that evidence varies substantially depending on the peptide, and that's an important distinction. For example, myostatin inhibitors. Myostatin is a naturally occurring protein that limits muscle growth. If you reduce myostatin activity, muscle mass can increase. That sounds great, but here's the question we should ask. What else does myostatin influence or the lack of myostatin influence? Researchers continue studying its effects on connective tissue, tendon adaptation, metabolism, cardiac physiology, smooth muscle, and other biologic systems. Myostatin functions as one of the body's natural brakes on muscle growth. Inhibiting that pathway can increase muscle mass, but muscle doesn't exist in isolation. Tendons, connective tissue, metabolism, and other signaling pathways all have to adapt too. That's why myostatin inhibitors are such an exciting area of research, but they're also a good reminder that changing one signal pathway can have effects well beyond the outcome we're trying to achieve. Researchers are still working to understand their long-term physiologic effects and where they ultimately fit into clinical medical practice. Increasing muscle size may be only one part of a much larger physiologic picture. That does not mean myostatin inhibitors should never be used. It means we should not pretend we have answered every long-term question. The science is still evolving. This is why I approach peptide therapy differently. I don't begin by asking which peptide does this person want. I begin by asking, why is this person experiencing these symptoms in the first place? Are they insulin resistant? Do they have chronic inflammation? Is mitochondrial function impaired? Are hormone deficiencies contributing? Is sleep disrupting recovery? Are nutritional deficiencies limiting normal physiology? Is oxidative stress preventing healing? Those questions matter because peptides do not work in isolation. They work within the biological environment they're placed into. Sometimes correcting the underlying physiology makes a peptide work better. Sometimes it changes which peptide, if any, is appropriate. And sometimes it reveals that a peptide is not the best intervention at all. That's why I recommend understanding the patient before considering the peptide. Once we understand the biology, there's another issue that is just as important. Even if you select the right peptide for the right person, you still have to ask one more question. Where did it come from? One of the most common questions I hear is, if the peptide itself works, does it really matter where I buy it? And the answer is yes. And the reason has very little to do with the concept of the peptide itself. It has everything to do with quality. The assumption that if two vials carry the same label, they are equivalent may not be true. The quality of a peptide depends not only on its sequence, but on how it was manufactured, tested, handled, and stored. Identity, purity, potency, sterility, endotoxin burden, and manufacturing consistency all matter when a product is intended for human use. Most products sold online are labeled for research use only, and that phrase has a very specific meaning. It indicates the product is not intended by the manufacturer or distributor for administration to humans. It does not by itself tell you whether a product is chemically accurate or inaccurate, but it does tell you it was not marketed as a medication for patient care. And that distinction matters because clinical decision making and manufacturing oversight are a very different world from buying a laboratory research reagent. Now, over the last several years, independent researchers have been analyzing peptides sold online as research-only products. These are the same types of products that many websites market directly to consumers without requiring a prescription or medical evaluation. And the findings should give you pause. In one of the largest published analyses to date, researchers evaluated more than 6,400 research-grade peptide samples marketed directly to consumers. This was in 2026. Depending on the quality standards applied, approximately 42% to 71% of those products failed basic quality criteria. About 15% contain measurable bacterial endotoxin contamination. Now think about that for a moment. When you purchase a vial online, you're not simply asking whether the peptides work. You're asking a much bigger series of questions. Is it actually the peptide listed on the label? Is the concentration accurate? Has the peptide degraded during manufacturing or shipping? Are there impurities left over from the synthesis process? Is the product sterile? Does it contain bacterial endotoxins? Could there be other biologically active compounds present that are not disclosed? Researchers have also published examples where products that appeared highly pure using routine laboratory testing were later found with more sophisticated analysis to contain additional biologically active peptide contaminants. That means someone could experience unexpected effects, not because the intended peptide behaved unpredictably, but because something else was present in the vial. And when a substance is injected, you're bypassing many of the body's natural protective barriers. That makes sterility, contamination control, and manufacturing quality critically important. When you inject something into your body, you are injecting everything that is in that vial. Impurities, endotoxins, contaminants, or non-sterile products may trigger inflammation, immune activation, tissue irritation, or serious infection. Now, before recommending a product for patient care, a clinician should understand where it originates, how it was produced, and whether appropriate quality systems are in place. Now, people will ask, whether a certificate of analysis proves a product is safe. A certificate can provide useful information, but it is only one component of quality assurance. It does not replace sound manufacturing practices, appropriate testing, sterility assurance, endotoxin testing, appropriate storage, or clinical oversight. This is one of the reasons I encourage people to be cautious about taking advice from social media influencers, online forums, or companies whose primary goal is selling a product rather than evaluating your health. Peptides are biologically active signaling molecules. They influence complex cellular signaling networks throughout the body. Even when the correct peptide is used, appropriate treatment requires understanding your symptoms, laboratory findings, medical history, medications, goals, and potential risks. And even if a peptide has the potential to help, you first need confidence that the product is actually what it claims to be. Otherwise, it becomes much harder to know whether the results you're seeing are due to the peptide itself or something else entirely. Understand, choosing a peptide and choosing its sources are inseparable decisions. The responsibility is not simply to ask whether a peptide may help. It's to ask whether the expected benefit justifies the risk, whether the evidence supports its use, whether the product is appropriate for clinical care, and whether it fits that individual patient's physiology. This does not mean peptide therapy is inherently unsafe. It means that responsible peptide therapy begins with two things: selecting the right patient, ensuring the quality and integrity of the product being administered. Now, as clinicians, we can spend a great deal of time discussing mechanisms of action and clinical outcomes, but none of that matters if we can't first be confident in what is actually inside the vial. That is why sourcing matters just as much as selecting the right peptide. Now, I believe medicine is moving away from treating isolated symptoms and toward understanding how biological systems interact. Peptides are one tool within that larger framework. They are powerful because they influence cellular communication, but their effectiveness depends on the physiology they are entering, and their safety depends partly on the integrity of the product being used. That is why personalized medicine requires more than selecting a product. It requires understanding the patient, understanding the biology, and understanding the source. If there's one thing I hope you take away from this video, it's this: peptides are biologically active signaling molecules, not nutritional supplements. They influence complex cellular communication networks that regulate virtually every aspect of human physiology. And while many peptides have remarkable therapeutic potential, the scientific evidence supporting individual peptides vary, and researchers continue studying their long-term physiologic effects. That is why peptide therapy should be individualized based on a comprehensive medical evaluation, including your history, symptoms, laboratory findings, goals, and risk factors, not generalized advice from social media online forums or someone selling a vial online. And once a peptide is being considered, the source matters. Identity, purity, potency, sterility, endotoxin burden, storage, handling, and quality oversight are not minor details. They are central to whether a product is appropriate for clinical use. If you found this video helpful, subscribe to the channel, and upcoming videos will make this foundation and dive into individual peptides, explaining what they do, what the evidence actually shows, and where they may fit into clinical practice, and just as importantly, where caution is warranted. If you'd like to discuss whether this or any other therapy may be appropriate for your individual situation, I'm always happy to have that conversation with you at Pinnacle Performance and Wellness. As always, thank you for watching. Have a great day, and God bless.